Sertraline, also known as Zoloft, is used to treat a variety of conditions, including depression, panic attacks, obsessive compulsive disorder, post-traumatic stress disorder, social anxiety disorder, and premenstrual dysphoric disorder. This medication can improve your mood, sleep, appetite, and energy level, as well as help restore interest in daily living. It may also decrease fear, anxiety, unwanted thoughts, and the number of panic attacks. Additionally, it can reduce the urge to perform repeated tasks that interfere with daily living. Sertraline is a selective serotonin reuptake inhibitor, SSRI, which works by helping to restore the balance of serotonin in the brain. The recommended daily dosage and optimal timing for taking this medication should be discussed with a healthcare professional. Before you start taking Zoloft, make sure to read the medication guide and patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take Zoloft by mouth as directed by your doctor, usually once daily either in the morning or evening. The tablet or liquid form of this medication may be taken with or without food. The 25 mg, 50 mg, and 100 mg capsule is usually taken with food. The 150 mg and 200 mg capsule may be taken with or without food. Swallow the capsules whole. Do not crush or chew the capsules. If you have any questions about how to take the capsule form of this medication, ask your doctor or pharmacist. The liquid form of this medication must be mixed with another liquid before use. Just before taking, carefully measure the dose using the medicine dropper provided. Do not use a household spoon because you may not get the correct dose. Mix the dose with a half cup, 4 ounces/120 milliliters, of water, ginger ale, lemon lime soda, lemonade, or orange juice. Do not use other liquids to mix this drug. The mixture may appear cloudy, which is normal and harmless. Drink all of the mixture right away. Do not prepare a supply in advance. If you are taking this medication for premenstrual problems, your doctor may direct you to take this drug every day of the month or for only the 2 weeks before your period until the start of your period. The dosage is based on your medical condition and response to treatment. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Follow your doctor's instructions carefully. Take this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Keep taking this medication even if you feel well. Do not stop taking this medication without consulting your doctor. Some conditions may become worse when this drug is suddenly stopped. Also, you may experience symptoms such as mood swings, headache, tiredness, sleep changes, and brief feelings similar to electric shock. To prevent these symptoms while you are stopping treatment with this drug, your doctor may reduce your dose gradually. Report any new or worsening symptoms right away. Tell your doctor if your condition lasts or gets worse. Some common side effects of Zoloft include nausea, dizziness, drowsiness, dry mouth, loss of appetite, increased sweating, diarrhea, upset stomach, or trouble sleeping. However, many people using this medication do not have serious side effects. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Tell your doctor right away if you experience any serious side effects, such as easy bleeding/bruising, decreased interest in sex, changes in sexual ability, muscle cramps/weakness, shaking, tremor, unusual weight loss. Zoloft may increase serotonin and rarely cause a very serious condition called serotonin syndrome/toxicity. The risk increases if you are also taking other drugs that increase serotonin, so tell your doctor or pharmacist of all the drugs you take. Get medical help right away if you develop symptoms such as fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea/vomiting/diarrhea, twitching muscles, unexplained fever, or unusual agitation/restlessness. Rarely, males may experience a painful or prolonged erection lasting 4 or more hours. If this occurs, stop using this drug and get medical help right away, as permanent problems could occur. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, get medical help right away. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Antidepressant medications like Zoloft are used to treat depression and other mental or mood disorders. They can also help prevent suicidal thoughts and provide other important benefits. However, some people, especially those younger than 25, may experience worsening depression, other mental or mood symptoms, or suicidal thoughts when taking antidepressants. It's important to talk to your doctor about the risks and benefits of taking Zoloft, especially if you're younger than 25, even if you're not being treated for a mental or mood condition. If you notice worsening depression, unusual behavior changes, or other mental or mood changes like new or worsening anxiety, panic attacks, trouble sleeping, irritability, anger, impulsive actions, severe restlessness, or very rapid speech, tell your doctor right away. Be especially careful for these symptoms when starting a new antidepressant or changing the dose. As for the daily dosage and optimal timing, your doctor will determine the right amount for you and the best time to take Zoloft based on your individual needs and condition. Before taking Zoloft, it's important to discuss any allergies you may have with your doctor. Also, be sure to inform them about your medical history, including any heart conditions, low levels of potassium or magnesium in the blood, or if you are pregnant or breastfeeding. Zoloft may cause dizziness or drowsiness, so it's important to avoid alcohol and be cautious when operating machinery. If you are using the liquid form of this medication, be aware that it contains alcohol, and consult your doctor if you have diabetes, alcohol dependence, or liver disease. It's also crucial to inform your doctor about all the products you are using before having surgery, including prescription drugs, non-prescription drugs, and herbal products. For older adults and children, extra caution should be taken as they may be more sensitive to the side effects of the drug. If you are pregnant or planning to become pregnant, discuss with your doctor the benefits and risks of using Zoloft during pregnancy. And if you are breastfeeding, consult your doctor before continuing to do so. Remember to always consult your doctor before starting, stopping, or changing the dosage of any medications. It's important to keep a list of all the products you use, and share it with your doctor and pharmacist. Some products that may interact with Zoloft include Pymazide, antiplatelet drugs, NSAIDs, blood thinners, and MAO inhibitors. Also, the risk of serotonin syndrome/toxicity increases if you are taking other drugs that increase serotonin. This could include street drugs, St. John's wort, certain antidepressants, and other medications that cause drowsiness. Aspirin can also increase the risk of bleeding when used with Zoloft. Make sure to discuss with your doctor any other products you are using that may cause drowsiness. Additionally, Zoloft may interfere with certain medical/lab tests, so be sure to inform the lab personnel and your doctors that you are using this medication. If someone has taken too much Zoloft and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call 911 or contact your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center for assistance. Symptoms of an overdose may include severe dizziness and fainting. Remember, it's important to not share Zoloft with others. Make sure to attend all of your regular medical and psychiatric appointments. This medication is used to treat depression, panic attacks, obsessive compulsive disorder, post-traumatic stress disorder, social anxiety disorder, and premenstrual dysphoric disorder. Your doctor will determine the best dosage for you, but typically Zoloft is taken once a day, either in the morning or evening. It's important to take it at the same time each day. If you forget to take a dose of Zoloft, take it as soon as you remember. If it's already close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. It is important to store Zoloft at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. Do not flush Zoloft down the toilet or pour it into a drain unless specifically instructed to do so. When Zoloft is expired or no longer needed, it should be properly discarded. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.